The content of this podcast is provided for general informational purposes only and is not intended as, nor should it be considered a substitute for professional medical advice. This is Karen Nickel, family nurse practitioner, and you are listening to Itchy and Bitchy, a podcast that provides answers to your many health questions. And today we're going to talk about skin and hair changes in menopause. This is a common complaint I get from patients, and so I thought maybe the listeners out there would like to hear about this as well. So, we often hear menopause called the change. And I would say that is a very good descriptor. So many changes throughout the entire body are triggered during this time of life, which begins 12 months after a woman's last period, or if someone undergoes surgical menopause by having the ovaries removed. Some changes may be welcomed, like no more PMS, no more periods, and no more swinging hormones, but other changes may not be as enjoyable. For example, the way skin and hair may change after menopause. Most people don't really appreciate those changes, and they're common complaints I get from my menopausal and perimenopausal patients. As my regular listeners will know, if you're seeing changes in your hair and skin post-menopause, you can usually blame rapidly declining levels of the hormone estrogen. When estrogen drops, our skin becomes dry because estrogen promotes plumpness and retention of water in the skin. Also, when estrogen drops, our hair becomes thinner because the hormone contributes to hair growth and fullness. If when you hit menopause you don't go on estrogen therapy, your skin will get quite dry. Skin also becomes thinner in menopause since there's a relationship between collagen production, skin thickness, and lack of estrogen. The other contributors to the exacerbation of skin dryness are the decrease in molecules called humectants in the skin and slowdown in skin turnover. And when can women start seeing changes in their skin and hair once they're in menopause? Well, some people will notice it overnight. Others may see a more gradual change, but it happens. Many women tell me that when skin changes happened, it did so literally overnight. Hormone replacement therapy, which would alleviate many of these issues, works well, but it is not for everyone, and not everyone is a candidate for HRT. Sagging and loss of plumpness commonly occurs in the skin. Of course, women notice it in their face and neck, but will also see thinning of their skin in the forearms, and as a result, they will bruise more easily in this area. I get that complaint quite a bit. Women also report having crepey skin on their upper arms. When estrogen drops, the skin's ability to produce collagen also decreases. And collagen is a protein that holds the body's tissues together. It's a matrix of sorts. The loss of collagen causes the skin to lose its youthful volume and tightness. To combat this problem, many people take collagen supplements or eat high collagen foods like bone broth. But, the jury is still out on this strategy. We just don't have enough controlled studies to show that consuming collagen, taking it orally, will help with postmenopausal skin. There are some things you can do to aid collagen production, such as an at-home facial massage. Use your favorite moisturizer and use a massaging motion on your skin of your face, which will stimulate your skin's collagen production. Of course, if you are a candidate for hormone replacement therapy using estrogen, this will really help maintain collagen production. Acne is another skin problem that arises in menopause, and for acne, I often put women on spironolactone, especially during perimenopause. And spironolactone is an oral prescription medication. It's also a water pill, as well as helping with some of these skin issues. It does a very good job blocking androgens. And while estrogen is dropping in perimenopause and menopause, the testosterone level remains constant. So that's why we get these skin changes like cystic acne, because we have lots of testosterone and not very much estrogen. I also recommend to my patients to take supplements that have anti-inflammatory properties like omega-3 fatty acids and curcumin, since acne is an inflammatory condition. As far as topical acne treatment products are concerned, you want to choose gentle products. Most acne products can be very drying, and that is definitely to be avoided. Salicylic acid, easy for me to say, salicylic acid cleansers are a good option. However, if you are getting cystic type acne, which is most common during this phase of life, topical treatments usually aren't the best option, but the medication I mentioned before, spironolactone, will really help. Other skin changes include dryness, flakiness, and itching. Back to that itchy and bitchy thing. You can usually manage postmenopause skin dryness with a good home care routine. So cleanse your skin daily and gently. Even if your skin is dry, cleanse your skin each day to remove makeup and daily grime. But don't use a foaming cleanser unless your skin is very oily. Moisturize daily. After menopause, many women need to up their moisture game. So moisturizers that contain hyaluronic acid help hold in water and can improve suppleness of skin. Antioxidant serums and creams like those containing vitamin C may also help. Avoid irritating ingredients. You don't want to make skin troubles even worse with ingredients that aggravate your skin. Avoid products that have fragrance or colors or alcohol. And products containing alcohol it's usually listed as SD alcohol or denatured alcohol. Take warm but not hot showers and keep your showers short and, again, not too hot. Hot showers strip your skin of its natural oils, leaving it really dry. And once you get out of the shower, moisturize immediately after you towel off, since skin can really absorb ingredients better when it's still damp. If you ever see redness or rashes, see your healthcare provider so the skin problem can be evaluated and treated appropriately. Dark spots often appear after menopause. That's another big complaint. And they're hard to treat at home. They don't usually respond that well to over-the-counter treatments, but there are prescription cream options that can help, like tretinoin cream. You probably know that better as Retin-A, which is a prescription strength retinoid. If that doesn't do the trick, then in-office procedures like facial peels or laser treatments can help fade those spots. These treatments are also pretty helpful in giving you a youthful appearance and a brightness of the skin. More on menopausal skin changes after this short break. It's time to seek out pleasure in every area in your life, from how to start your mornings to how you wind down at night and everything in between. You deserve to enjoy it all. Dipsy Stories wants you to find joy and confidence in and out of the bedroom. In my practice, I hear from women every day that they have no sex drive. Dipsy Stories app offers an answer to this problem. This app is full of sexy audio stories, and now they even have brand new written stories. Close your eyes and let yourself get lost in a world where only good things happen and pleasure is your only priority. Explore your fantasies in a safe, shame-free way. No matter who you're into or what turns you on, Dipsy helps bring the stories to life anytime, anywhere. There are hundreds of stories to choose from, and they release new content every week, so there's always more to explore. And they also have wellness sessions to help you wind down and sleep sessions to help you drift off. For listeners of this show, Dipsea is offering an extended 30-day free trial when you go to dipseastories.com/itchy. That's 30 days of full access for free when you go to dipseastories.com/itchy. dipseastories.com/itchy. Other skin changes I see in perimenopausal and menopausal women include flushing. Gosh, if we talked about that before, I wonder. But we can get flushing not just because of hot flashes, but it can occur due to rosacea or skin reactivity. And the rosacea will often be, redness of the nose and the cheeks, and sometimes it's a burning sensation, and sometimes we actually have little pimples on the cheeks from it. And some of it is related to vasodilation that we have in menopause, where our vessels dilate and cause redness of the skin. And there are a lot of good anti-redness products on the market that work well. And there are prescription treatments like metronidazole cream, which I use quite a bit for people, or doxycycline, which is an oral antibiotic to help with rosacea. Increased sensitivity happens as we age, and the natural lipids in our skin diminish. And studies show that after the age of 50, the pH level of our skin gets higher. There's a certain level, pH level 5.4, where the pH of our skin allows for optimal operation of our microflora, so the good bacteria on our skin, and our defensive cells in our skin. And as the pH level climbs, those cells are less able to help defend the skin, and we're more prone to rashes, sensitivity, and dermatitis. It becomes important to repair the skin's moisture barrier with a good, effective emollient. Another thing that can happen is unwanted facial hair. Yeah. And it probably doesn't help that as we go into menopause, we also need a magnifying mirror to see what we're doing. And then we see all the facial hair. We can start to have unwanted facial hair as our hormones shift. An appearance of the hair on the upper lip or the chin is pretty common. Of course, the tried and true methods of tweezing, waxing, hair removal creams, and threading will address it, but it won't provide a permanent solution. Electrolysis is a permanent hair removal solution, and it destroys the growth cells in the hair follicles so that they don't grow back. Most people need several appointments to get results, and if you decide to go this route, choose a licensed electrologist or ask your provider for a recommendation. One thing to remember, however, is that the laser technique targets melanin, which gives color to your hair or skin. And so laser treatment only works on dark hair. If you have light hair, laser is not going to solve your problem. Earlier, I mentioned the prescription medication spironolactone, which in addition to help address thinning scalp hair and acne, it also reduces facial hair. I know it sort of sounds like a wonder drug, doesn't it? But I do use it a lot in menopausal women for this very reason. It does a lot of good hormonal things for us. And this med is usually dosed 100 to 200 milligrams once a day. So as we start growing hair on our face, we start losing hair on our scalp, which is not desirable. So estrogen really promotes hair growth and density and fullness. And so during menopause, people may notice their hair is thinning, is less full, or shedding more. I often hear women say, my ponytail is teeny tiny now. It used to be a big ponytail. I don't have that problem because I always have short hair. But if you see these hair changes and your scalp is dry, use a gentle moisturizing shampoo and wash your hair less frequently. However, if your scalp tends to be oily, you may want to wash your hair daily, and of course, you are welcome to do that. Sometimes in menopause, we can develop something called androgenetic alopecia. This is more commonly known as male or female pattern baldness, and it can cause overall thinning or bald spots. Usually we see the thinning at the frontal hairline, so we see this sort of receding hairline. Over-the-counter products with the ingredient minoxidil, which is branded Rogaine, can help. I also prescribe topical finasteride in a spray form, which has to be compounded. The prescription oral medications, spironolactone or finasteride orally, can also help. Those also have to be prescribed. Neither med should be used in women who are in their childbearing years and are not using a very reliable form of birth control, because both of these meds can cause birth defects when taken during pregnancy. Once menopause arrives, the following skincare options can help. Number one is retinoids. Retinoids are a derivative of vitamin A, and they definitely slow down the photoaging, and they also repair the skin layer called the epidermis by stimulating new collagen growth. It's safe, and as long as the treatment you choose doesn't dry you out, it's fine to use for an extended period of time. That being said, retinoid use by pregnant women has not been extensively or adequately studied. However, absorption of retin-A or tretinoin into the body is very minimal. So if you were using tretinoin when you realized you were pregnant and then stopped, don't worry. It's very unlikely that the small amount absorbed would do anything to a developing baby. Peptides are another thing that can be very helpful. These also stimulate collagen production and boost skin's elasticity, which is important as skin becomes thinner and starts to sag. I think peptides are great as you age, and I suggest them for anyone over age 50. Not that you can't use them before, but definitely over age 50. I use a peptide product from a company called The Ordinary, and their products are good and very cost effective. A really good, rich moisturizer is so important as we age, and something that has hyaluronic acid or glycerin will be particularly helpful at easing the dryness that many women experience in menopause. It can also be very helpful to do a gentle at-home peel once or twice a week to remove dead skin cells. Yes, we have them. To brighten our skin and to allow the products we use to more easily penetrate the skin. Again, I do a weekly peel product from The Ordinary. I am pretty good about doing it weekly, but I sometimes miss a week or two. But it is a very good product. All of these recommendations can really help your aging skin, but please, please, please don't forget that sun protection is a must. The sun rays age your skin and increase your risk for skin cancer, even in the winter. Everybody hearing me? Even in the winter. No matter what your skin challenges are, sunscreen is your friend. Slather it on every day, all year round, and sun protection can ward off signs of aging and prevent skin cancer. Use a broad spectrum sunscreen that's at least SPF 30 or higher. Choose one that you like so you'll be more likely to apply it every morning. And if you're going to be outside, reapply every 2 hours or after swimming, sweating, or toweling off. So I have a really good skin foundation. What's it called? Skin foundation. Again, it's from The Ordinary, and it has a high SPF in it. And so I make sure to use that every day on my face. And I know I talk about this every time we meet, but for healthy skin, make sure to take care of you. We may not like what time and hormone changes do to our skin and hair, but you have the power to maximize your well-being. Eat a healthy diet, get regular exercise, don't smoke, and see your provider, your healthcare provider, regularly. If you make good health a priority, you'll feel and look your best. Also, taking vitamin D3 if you have vitamin D insufficiency or deficiency is also very important to help keep skin firm and support skin repair systems. Many of my patients require a 5,000 IU daily dose. However, if you are not able to get your vitamin D level in your blood checked so that an appropriate dose can be recommended, I recommend taking 2,000 IUs daily. Finally, if you notice any of these signs, you need to see your primary care provider or a dermatologist. And those include distinct circle-shaped bald spots on your scalp, like where hair is completely gone in a circle, hair loss that occurs with itching, burning, or pain, pimple-like bumps on the hairline, or hair coming out in clumps, or a rash. If you think of other questions you have about your health and would love to hear about it on this podcast, please visit our Facebook page, I&B Podcast, where you can leave your comments and questions. Our website is itchyandbitchy.com. Many thanks to Dipsy for sponsoring today's episode. As always, thanks to Forrest Wenzel, our producer and composer of our theme music. He has released an album called An Awful Lot. Make sure to go to wherever you stream your favorite music to listen. If you don't know where to stream music, which is possible, you can find the album on Apple Music or Spotify. As always, remember that your health is in your hands. See you next time.